Everybody, and welcome to Nirvana Naturopathics YouTube channel. My name is Lana Mashkovich, and I'm a doctor of acupuncture and Chinese medicine at Nirvana Naturopathics. Our office is located at 707 Lake Cook Road, Suite 100. And the major intersections are Lake Cook Road and Kingston. It is really, really easy to find. Today, I would like to discuss urticaria patient. This patient come in with hives. It's a very common problem in our world. If we look on a website and we search urticaria, we can find that urticaria, also known as hives, and it is an outbreak of pale red bumps or plugs or wheals on the skin that appear suddenly, either as a result of a body reaction to certain allergens or for unknown reasons. And this is basically a burning sensation, very itchy. 20 to 25% of general population suffer from chronic urticaria or hives. If we look at every 10 people who suffer from hives, we can find that 7 people are suffering from chronic urticaria, and it lasts from weeks to years. And acute urticaria is basically when the person suffers for 6 weeks, but 6 weeks or more is already considered chronic urticaria. I'd like to discuss this case study, and we have 43-year-old female. She's a beautiful woman who suffers from hives for more than 10 years. Lately, those rashes become very, very prominent and very often. She is a pharmacist, so imagine her knowledge about what is hives, how to treat it, and she tried a lot of different things with years. Probably that's why she decided to step in and try acupuncture. But lately we see a lot of medical Western practitioners who come in to try acupuncture and resolve their problems. We have medical doctors, we have dentists, nurses, lots of different psychologists, different types of Western medicine practitioners who come in. That antihistamines usually help in the past. However, lately, there is no help. She cannot sleep at night because those hives come in at night and it's very uncomfortable and itchy. Very terrible sleep that she might have. And she is young, as I mentioned, 43-year-old. She has 2 children, and life is not the same as it was before. So now we think, what might trigger those very often hives? Most of the time, it's a stress, and we always, everyone have their weak spots, I would say. That somebody struggle with hypertension, somebody struggle with headaches, and stress triggers those weakness in the body, and this is how things appear. Now we know many different problems, and for example, immune thing is a herpes zoster, which usually appears on the lips or on the nose. And those things triggered by stress also. A lot of different problems come in after stress. So this patient came in on July 20th. She had her visit, initial consultation, as we usually do. We never start treatment without comprehensive evaluation. So we find out that it was recently, she struggled with, I would say, women health issues, and it's not like it's a women health particularly, but a loss of a child considered our personal things. Twice she lost the baby, and that definitely contributes some kind of stressful, chronic stressful struggles and events. So on July 20th, that was the first evaluation that we had. At the very beginning, on the first session, you should know that we always do initial evaluation. This is very important process. We need to find out what happened and what's the causes. Usually it's unknown causes, but it's interesting to review a patient history and find out about a life and a lot of different things. So on the first visit, we actually talk about diet, and this woman is very, very healthy eater. She mostly eat fish, salads, vegetables, fruits, asparagus, pasta only once a week, fish once a week, as well as grain. Protein snacks. Meat is not a primary staple in her diet, so doesn't like a lot of meat. She skips breakfast because she tried intermittent fasting for her problem. And when we discuss her lifestyle and stress level, we find out that it was a lot of stress, chronic stress in her life because um, she lost two babies, and she was pregnant twice, and it was just unfortunate miscarriage, and that usually gives us women a lot of deep-rooted stressful things in our life. So after that, she actually admitted that she become more prominent to those very often hives that happens. So I saw this patient on July 20th for her initial visit. I saw also her 3 times for acupuncture that happened in July 23rd, 25th, and 30th. In August, I saw her 5 times on August 1st, 6th, 8th, 20th, and 27th. And in September, I saw her for follow up. Every single time that she came in, she said she felt better. Only one time that she had a real big flare up, where not only she had those red patches on her legs, she also had swollen lip um, uh, and eyelid. Now, I saw her on September 5th. That was the treatment number 9. And she stated it was her daughter's 23rd birthday. And they celebrated definitely with some alcoholic drinks. She usually does not touch those because we discuss all of those dietary things, and we know that alcohol usually attribute to flare-ups of hives for her and for a lot of people. And so she avoided all of the time. Now, when she came in on September 5, she admitted that she had 4 drinks on her daughter's birthday day, and she didn't have any flare-ups. And this is very excited to see that even though we know the triggers, we know there are foods that triggers those hives and alcohol, that we reach the point that this patient has 80% improvement by her 9th treatment. And I would like to say that whenever we have acupuncture, and we do it quite often, see this patient had she came in 3 times a week, then 2 times a week, that we reached that kind of 80% improvement when we see and when the patient receive acupuncture so often. And now we have another strategy, because the patient already reached 80%. We are really happy. And then I will see her every week, once a week. And if there will be such an improvement as we see, then we don't need to see her once a week. We might see her once in 2 weeks, and so on. In the future, as we see progress, as we reach 100%, we might see this patient once a month. And I'm very happy to tell you the story. And most of the time in our practice, we see patients with chronic conditions, um, like this one, and other chronic diseases. But most of the time, we see people with pain in the low back, headaches, neck pain. And if you want to resolve your problems, please visit our website. And I really encourage you to go there, because we organize our reviews and testimonials by other people on the website, and you can definitely see um, and review those things by the chief complaint. And it will be just easy for you to see what people say, how they are they are happy with their results. Now, there are also case studies on our website, and the website is nirvananaturopathics.com. If you would like to schedule an appointment, you can definitely do it online through the website. You can always call 847-715-9044. And I'm really happy to share our success, our patient happy results with you. If you like our YouTube channel, please subscribe and like us. You can also post any comments below, or you can give us a call. Well, thank you so much. My name is Dr. Lana Mashkuch. I'm really happy to be part of your lives.